How do you bring that into the picture to focus on the value of digital and the website in particular?
Well, and it was some of those challenges I remember having, even pre-pandemic, just around, we knew that we were, on an outdated CMS platform and we needed to invest in the website. And, we faced some of those same challenges of, well, we've got a limited amount of dollars. And so where are we going to invest it with as an organization? And I don't know if it was an aha moment, but I was like, but wait a second, the website is actually the literal digital front door to our organization. And many times it's the first experience somebody has with our organization.
How did you bring that conversation up, and how did you, I guess, socialize that idea of this is really something that's important to the organization, as opposed to you saying, that new, I don't know, MRI machine or whatever?
Yeah, I mean, certainly we used the one data point that I shared with you. The other was, or maybe it's considered a scare tactic, but I was like, just imagine if the site goes down. It's dark. So if the website were to crash, right, for whatever reason, or go dark, it's going to impact your business financially and operationally. That's really, and for people to really think about that, I don't know that we were able to go down the road of trying to calculate how much that was, but also if all of your online scheduling is people are coming through your website to do online scheduling, it would be like Delta's website going down for a day, right? Think
Yeah,
about an airline's
yeah, that's
website
crazy.
going down, disappearing for a day.
Hello, everyone. Today's conversation is about a line that struck me from Amy's new book, in which she said that healthcare marketers are actually patient-facing, something that's not always obvious. She was, during COVID, which is basically the essence of what her book is based on, that really wasn't quote unquote motivational language. It was an operational reality. And for many patients, the first interaction that they actually have with the system isn't through the clinician, it's through the website, it's through a registration form, it's the booking workflow. And so that website really is the front door to care. So right now we're in a different type of tumultuous time. Even though it's not COVID, there's a lot of budget pressure, there's political volatility, there is strain on the workforce. And the essence of the question hasn't really changed, right? The website, it's that first clinical touch point, but are we really treating it in that sense? So the reason I felt Amy was a really good fit for this conversation is that she led marketing at Emory for 17 years, including 7 as VP, and her experience navigating that crisis and the prioritization and the digital actions that she had to focus on then is super relevant now, even though we're just a few years after the COVID crisis. And so Amy, thanks for being here, and you can introduce yourself a little bit, and I'd really love to figure out from your perspective, when did you understand that healthcare marketing is not adjacent to care, but really directly part of the care?
Yeah. Well, Brad, thanks so much for having me on today. And I know I'm going to really enjoy the conversation. So for those who don't know me, I'm Amy Comeau. I was head of marketing, as Brad mentioned, for Emory Healthcare for a long time. It owed me the opportunity being there during COVID to publish my first book, which is called Every Storm Runs Out of Rain. And while it is about COVID, that's the lens, it's really a leadership book about leading oneself and one's team through crisis or chaos. Now I'm independent and I'm doing marketing consulting for nonprofits and healthcare organizations, including my love of the arts. And so I'm just happy and continuing to speak and promote my book. So I'm happy to be here. So to answer your question
Fantastic.
around, that frontline concept, I think I always knew it instinctively that healthcare marketers and communicators really were patient facing. But it wasn't until when we started to face some of the financial pressures during COVID, and when organizations were forced to prioritize what types of roles they were going to fill and which types of roles they were going to keep on hold. And for us at the time, it was those roles that are patient facing will continue to be filled. And so at that point, I tried to make the business case that marketers really are patient facing. And they are, and we can continue to talk about that. But in some people's eyes, patient facing are only those people who actually are delivering care to patients. And so that's when it really crystallized for me. But I'm happy for us to continue to have a conversation.
Yeah, absolutely. And I wonder if, and there was that rallying period with COVID where everybody was like, we are all healthcare workers. We need to, get the vaccines to the population, et cetera. But has that feeling changed? Because it might have been maybe more prevalent back, a couple of years ago. Do you feel that today healthcare marketers are being pushed kind of back to the sidelines? Like, what's your view of that, and why would that be the reflex of considering people who are helping to educate, to communicate, to help people get to that care as not being part of the equation as much as frontline healthcare workers?
I think it really depends on each organization. There are organizations out there that, I mean, they value all of their employees, right? But there's some that really understand the value proposition of marketing and communication, not only as a growth engine for the organization, but as really helping with patient acquisition, retention, and loyalty. Certainly, there are other organizations that are cash strapped, and so they have to make some tough priorities around whether they're going to invest in a new MRI machine or they're going to invest in their website. So I really do think it depends organization by organization on their certain circumstances. And so I'd be curious to talk to other colleagues in the industry to see kind of what they're feeling.
And do you have like an example where because I know that, throughout the book, as I was reading, you would provide these examples in your weekly emails to the team, and you would say, hey, this is a specific reason why you should consider yourselves as being frontline healthcare workers. Where, it could have been like, hey, a campaign allowed people to, in the COVID sense, was to get the vaccine, which they might have not have. It could be a breast cancer screening. And you were saying about how a percentage of those people are going to, be able to identify in advance a cancer that they might not have thought about, right? And you're actually saving lives. So what examples could you give as, this is a real tangible example of how healthcare marketers are part of the care continuum?
Yeah. Well, it's a great question, and actually one that I spoke about at a conference earlier this year around making the business case for healthcare marketers and communicators as being frontline and patient facing. And so, I mean, a couple of the examples you used, we would not have vaccinated as many hundreds of thousands of people in Atlanta had it not been for the work that our team did. They were the ones that wrote the emails, that sent out the emails, that managed the, CRM systems behind all of the wide variety of vaccination, what's the word I'm looking for, qualifications, that because we know they kept changing almost by the hour, it seemed like. And so that's a real example. And I could say to them, the work you are doing is truly saving lives because you are helping these people in our community get vaccinated against the vaccine. The second example that you also mentioned was one around our population health efforts. And this came a few years later. And one of my goals has always been to help make sure that my team understands the value that they bring to the organization, not just from a business sense, but how are we meeting the mission of improving lives and providing hope? And so wherever I could, I would try to make that connection that the work that they were doing is actually impacting a human being's life. And so you mentioned breast cancer. So we used our CRM and our marketing automation and our content teams to develop a automated campaign for people who needed to get screened for breast cancer. And because we had set up all the tracking and we had partnered very closely with our clinically integrated network and population health teams, we were able to measure that impact. And so I don't remember the numbers exactly, but we tracked it. And let's just say it was like there was 100 people that got screened, which meant, we found 2 cancers. Again, I use the math of how many cancers are
Right.
found and how many of those lead to, to cancer diagnosis. And I said, the work that you did helped, 2 women or people who identify as female as birth find cancers. And now they're going to have a better life, hopefully, right? And they're going to be able to treat that earlier because of the work that the marketers did, right? Sure, that it's going to be the clinical teams that are going to deliver the care and take care of the patient, but that patient would not have identified that they had, in this scenario, that they needed breast cancer treatment without the work that our teams did.
Right. And so you're part of that awareness of making sure that people actually go to get that care. And there's also the nuances that you did, get into in the book as well about how to differentiate your system versus the other ones in the market where, I remember some, examples of people saying, oh, I wish I had come to Emory earlier, for example. And so I think this is really interesting and relevant in that sense, because sometimes it could be seen as we're just doing ads and this is all just kind of conversions or whatever. And it's just dollars and cents, but it's people's lives at the end of the day. And that's how you get to contribute to the overall community. So when we're in that kind of mindset and, shifting in that sense, how does the perception of the website and the digital ecosystem evolve in the sense where there's a lot of projects and what I've seen in your experiences, you're a very long-term thinker. You're building these infrastructures, be it the CRM, rebuilding the website, making sure these systems are in place to be able to build upon and to extract the insights and the data to be able to report on the value. But what's the mindset shift between, an organization that sees, let's say, the website as a cost center and, maybe your perspective is saying, hey, we need to invest in this because it's maybe something we have control over. It's something that we can improve on and influence either care or the overall KPIs with. How do you bring that into the picture to focus on the value of digital and the website in particular?
Well, and it was some of those challenges I remember having, even pre-pandemic, just around, we knew that we were, on an outdated CMS platform and we needed to invest in the website. And, we faced some of those same challenges of, well, we've got a limited amount of dollars. And so where are we going to invest it with as an organization? And I don't know if it was an aha moment, but I was like, but wait a second, the website is actually the literal digital front door to our organization. And many times it's the first experience somebody has with our organization. They're looking
Right.
for care, they're moving to a new market, trying to figure out, where they want to, what doctors they need and which health system to go to. And so I did an exercise. I think this is when I was building the business case to get some additional dollars to do the website renovation. And we were able to calculate that I took all of the outpatient visits in a year and then all of the inpatient discharges in a year, added those all up, and then looked at our unique visitors and total traffic to the website. And I was able to demonstrate that more than 2x, might have been 3 or 4x of people are coming to Emory or coming to our organization through that access point of the website than they were actually physically coming through our actual doors. And so that just helped
Wow.
that gave some data to reinforce, like, look, this is literally the front door to our organization. And it's important for patients, but it's also important for recruitment, right? So we know some of the challenges
Absolutely.
right now are with, employee recruitment and retention. So it plays a big role in that. And then, as we already know, it plays a big role in many people trying to access their medical records. Right. So certainly you might have an EMR, you might have an app on your phone that you can connect directly to it. But some people prefer to use their laptop or their desktop to do that. And most are coming through your website to access that information.
Yeah, absolutely. I just want to kind of jump on a little sideline you had there about HR. And overall, the trends are that the amount of staff, be it, clinical staff, but also support staff, that's a huge shortage right now. And it's very important to the executive teams. And so marketing and HR collaborating more to be able to get a HR brand out there and to leverage that. And then that, we often talk about that patient journey, but the candidate journey is also as important, and the website plays a critical role in that one as well. Uh, and to connect all this with, the current environment where AI and LLMs are driving a lot of the research today, when people arrive on websites, they become even more important to deliver fast on the actual information or the eventual transaction that whoever is visiting the site wants to complete, because it's no longer about this kind of let's browse and figure stuff out. It's more about, I've already done that research and I'm at the website now and I want to get to my next step. And if the website is giving me roadblocks to get to that, then it's literally, stopping that individual from getting the care, or you're losing a candidate for a potential, clinician or something. So I think the website, even though there's maybe less visits today overall, the importance of each visit is even higher.
I think so. And, it's interesting. So I was at a meeting a couple weeks ago that was actually about, it was an architecture firm, and they were talking about intentional design of buildings now. And one of the comments that really stuck with me was that your building, the environment that you're inviting people into is essentially a cultural billboard. And it's basically speaks to people as to what they can expect by interacting with your team or your company. And I'd argue the website is the same thing, right? It
Yes,
is
absolutely.
literally the first brand impression that most people receive. And so it should mirror the quality of care that is happening at your organization and reinforce and reassure people on why they should, want to work there or seek care there.
I love the way that you're connecting this with other kind of, and I think that's part of your artistic background, right? That you're able to kind of connect these dots in other fields and bring them together. And I think there's a real value to not just seeing this, with in a very narrow way, but how there's an overall influence of how the perception of the experience on the website is going to impact the overall experience and perception of the care, because this is the first, as you mentioned, since it's that first starting point of interaction, because there might be ads, they might have seen a billboard or a digital ad, but they're not really interacting with
Right.
the system at that point. But when they do get onto the website, now they are controlling their own journey. They've decided to go to this page. They're going here. They're clicking on a form. They're filling something out. And so that's the first time that they actually get to really interact with the organization and see
Yeah.
how it's responding to their needs and wants and their own flow.
Yeah. I think it's really important. You mentioned that because we're talking about a world search and is what zero click search, right? To your point where
Yeah.
you're going to go and you're going to search something, and most of us are going to be using Google, but or whatever your search of choices, or your AI agent, right? Your AI of choice, and it's going to deliver you information. And we're not going to be, well, we'll ultimately need to figure out how to control what information is being delivered. And that's the challenge for my colleagues that are still leading marketing teams out there, because I know it's constantly changing. But this is where we talk about the fallacy of using, focusing your website on only the areas that you're marketing. That may not be what people are coming to your website for. So if they're coming to your website for, let's say, dermatology, because
Hmm.
dermatology is hard to, there's always historically been access challenges with dermatology, and you're not
Right.
marketing that because of that. Is the website experience still up to snuff with somebody who's coming in for cancer treatment or transplant treatment? And when you have small teams, that's hard to prioritize those things, right? But I think
Yeah.
it's really important to be looking at the entirety of your website and who it serves, and not just as a marketing tool.
Yeah, that's a great point. So how do you, and it's more holistic, right, in the way you're kind of describing it. And I really like the example you gave a bit earlier about how you were able to explain the story of like, hey, there's more people going to the website than actually physically visiting our facilities. What are other ways that you've built the case on the executive level to invest in digital, in marketing, in the website? How did you bring that conversation up, and how did you, I guess, socialize that idea of this is really something that's important to the organization, as opposed to you saying, that new, I don't know, MRI machine or whatever. Like, how do you equate those things and build that case?
Yeah, certainly we used the one data point that I shared with you. The other was, and maybe it's considered a scare tactic, but I was like, just imagine if the site goes down. It's dark. What does that do to you, executive, or you, physician, or you? What does that do to your day to day?
Mm.
Patients won't be able, if they're looking for addresses, they may or may not be able to find it. If they're looking for prep instructions, they may or may not be able to find it. Certainly, I know that whether we like it or not, a lot of a lot of employees will use the main website to access intranet. And so they might need it for their day to day. So if the website were to crash, right, for whatever reason, or go dark, it's going to impact your business financially and operationally. Really, and for people to really think about that. I don't know that we were able to go down the road of trying to calculate how much that was, but also if all of your online scheduling is people are coming through your website to do online scheduling, it would be like Delta's website going down for a day, right? Think
Yeah.
about an airline's
Yeah. That's
website
crazy.
going down, disappearing for a day. How
I'm,
many lost how would that impact air travel? How many upset people would there be? How much lost revenue? All of that. It's the same thing.
Yeah, man, that's great. And we often compare, right, our healthcare websites with airlines or banks or whatever. How can they get this, personalized experience, make it so seamless, and then it seems so complicated in health systems. There's
Mhm.
also, I mean, it's an industry that moves maybe more slowly, is a bit more conservative, with justification, right? Because we don't want to jump onto something that's not viable or not proven, right? Because we're talking with
Mhm.
people's lives here. But at the same time, I think it's important to kind of continually invest in digital and meet the patient where they are. You were talking about online booking and how many systems and hospitals and whatever clinics that are part of their network have doctors who are like, oh yeah, I'm not going to do the online transaction thing. They have to phone, to
Mhm.
get to my to get care from me. Like, I'm always perplexed by that. Whereas, like, how can you not be as patient centric and understanding that the way they're interacting in that quote unquote millennial mom who's taking care of her parents and of her kids, right? She is constantly online. And it's a turnoff to say I have to phone like a
Mhm.
phone number to kind of book my appointment with my dermatologist. I guess I'm just ranting a little bit here, right? But I'm like, why? Like, they got to pick up the pace to the realities of the current world. And maybe it's because of that access problem where there's that demand and, there's not as many physicians available as the demand that's there. So, they maybe have the incentive to not change
Mhm.
as fast as they should. But yeah, it's just kind of quite a situation.
Yeah, I mean, and there's a lot of reasons, within organizations that make that challenging. And I think all of us that have worked in healthcare understand why some of that stuff is more challenging than it seems. But at the end of the day, that's what the consumer, right, is looking for, a seamless experience to be able to do all that transaction online. I mean, I can't imagine. I actually had to call a boutique hotel to cancel a reservation
Oh,
recently.
wow.
Yeah, and I was like, why do I have to call them?
Right,
Can't
but
I
that
just
but
do
that's
this?
kind of ubiquitous in the health system, right?
Yeah,
It's oh yeah, well, I have to stay on hold for the X many minutes and I have to cancel this thing, blah blah blah. And
yeah,
but just kind of get to the back to the subject at hand. So we were talking about the website and bringing it up and seeing it as an investment. And one thing that kind of connects with uh, another kind of your big initiatives, which is being very strategic, ruthlessly strategic. I think at one point you were mentioning on what are we prioritizing and what are we not. And
yeah,
so, how do you identify at a certain point, like, this is what we need to focus on, this is what we should not be focusing on? There are elements of, like,
yeah.
what's within our control or not, but I'd like to let you kind of speak to that because I think that's one of the challenges that I've seen a lot is that everything is important all the time. Everybody's opinion has to be considered, like everything's a kind of
Mhm.
consensus. And so, how do you approach being disciplined with prioritizing?
Yeah. I mean, I think there's 2 lenses to look at this, right? So you've got if you already have your established marketing plan, you're gonna look at, okay, on there, you're gonna prioritize the different levels of what you have based off of what's most important, what's gonna drive the most value to the system, right? And that value can be in a variety of different ways. I think the key though, and this is especially important for marketing leaders, is that their marketing plans should cascade off of the strategic plan for the organization and the annual, if there is hopefully there's an annual operating plan. And so one of the things that I always did, because it's as important to help your team get the work done and understand how it fits into the strategic plan, it's also how I would share how we were going to prioritize our work with internal leaders and constituents and say, all right, here's the strategic plan. Here are the, 4 priorities for the year. And here's how marketing is going to support those priorities. Your need or asked of marketing isn't it does not ladder up to the strategic plan, then I'm going to have a hard time developing the business case for how to support it unless it's untapped revenue, unless there's something that then we need to partner and then bring to leadership and saying, look, we've got an opportunity to, we've got a lot of capacity in a certain service line. So we want to actually do a quick
Right.
turn, campaign to try and fill these slots. But you've gotta have it tied to the strategic plan, and I think then you've gotta see, okay, out of the strategic plan, where can you drive the most value and where can only you drive the most value. So this gets to that concept we said about, what matters and then what you can control and focusing on that where that overlaps. But if it doesn't tie to the strategic plan, then there's something missing. And I would say that's the first thing that leaders need to do is connect their marketing plan to clearly to the strategic plan so that what they're doing is clearly defined as supporting the organization's overall objectives for the year.
I think that's really valuable. What percentage, right, of the initiatives or time spent or money spent goes to that? Because there is like a minimum amount of effort and budget that has to go into the ongoing marketing operations, right? As you were saying, these campaigns have to continually go on. There's going to be capacity to fill in certain specific
Yeah.
pockets at certain times. So there's a level of minimum kind of ongoing stuff.
Yeah.
And so what percentage of the budget and effort would you allocate to these organizational level priorities?
Yeah. I mean, so we always looked at like, here's what we know we're going to do, what we need to do every year, like infrastructurally, here's what we're going to need to do to make sure, maintain the technologies for our website and CRM and all those things. And to many people are going to have evergreen paid search campaigns. And so, what you need to do to quote unquote, keep the lights on every year.
Right.
So you need to make sure that you're investing in that to keep that going, right, at the level that it needs to be as, with inflation and just, technology improvements and all that. So you've got to look at that first. And then you will see that, what do you have? Well, if you're a flat budget and you say, okay, you've got a budget of X million dollars, then you see what's remaining and you say, okay, with this remaining dollars, we can support XYZ initiatives.
Right.
If you're lucky, you're gonna parallel path your marketing strategy, your strategic plan, and your budgeting all together at the same time. So instead of it being a reflexive or reactive, okay, I've got X million dollars to execute off this marketing plan, it's going to say, no, strategic plan is saying we need to grow X service line by 10%. We're going to open, 3 or 4 new AMCs or not AMCs, AC, what's it, ambulatory care centers, right?
Right.
Like a care center or a facility or whatever it may be. Well, then you're saying, okay, well then in order to achieve that level of volume, in order to support the go live of a new facility, to support the onboarding of a new, it might be merger and acquisition, to support the onboarding and integration of a new hospital or a practice, this is what's going to be needed. And so you're literally doing zero-based budgeting based off
Right.
of what the needs are. And if you've done your work really well from a marketing team perspective, you've already been tracking baselines and performance. So you can say, all right, based off of last year's or, 3 years of experience, we know that it's going to take a million, a million not a million leads, but like a million visits to get,
Right.
10,000 leads. That's going to then turn into 1,000 appointments. You want to
Right.
be able to do that math to say, okay, well then we're going to need to invest X, Y, Z in these marketing plans in order to achieve that. That's not always what can, that would be an ideal state. And we know in
Of
the
course.
world of healthcare, nothing is ever ideal state. So you make
Right.
it work.
Exactly.
Yeah.
And that data is so different. And I mean, every I think system has a very different level of access to that data and integration of that data with the other systems, and even just tracking of the data on the website, especially with the
Yeah.
whole HSS kind of
Right.
Google Analytics Pixel thing.
Or,
There a couple of organizations were kind of flying blind for like 2 years, right? So you have to work with the play the cards you have, right, as opposed to the ideal kind of royal flush or whatever that
yeah.
everybody wished they had.
Yeah, exactly.
What and like kind of delving into these prioritization decisions and connections with the overall kind of strategy of the organization. When I was reading through the book, one of the milestones or investments that you made was to, as you mentioned a bit earlier, that redoing the website. And one of the ways you had positioned it is, hey, fixing the website is within our control. So how did that, what was the catalyst to saying, hey, it's been, kind of quote unquote stagnating for a couple of years. There's a strategic imperative, and now's the time to do that. What was the catalyst of saying, "Hey,
Yeah.
this is the time"?
Well, I would say the reality is that that was a business case we were bringing, year after year, year after year, and finally we got to the point where we knew that the software or the technology that our website was on was no longer being supported by. the
Okay, right.
company that made it, right? So we knew it was sunset. It was on its
Right.
way to being sunsetted. And so there was an urgency. It was one of those things, yeah, you can kick the can down the line only so much. And then we finally said, "Look, we got to do this and we got to do it
Right.
now." And so I think how we got to that, the planning part that you're talking about is that we had gone through, we had converted to becoming an Epic shop. And there's a lot of change. And during the time that I was at Emory, we grew from a 2 hospital to an 11 hospital system. So there was a lot of merger and acquisition and
Okay, right.
technology integrations and all that. And so my team, your team, and I don't know if this happens to every marketing team, but sometimes we always focus on what what we can't control. Like, well, we need, XYZ part of the organization to do this, or we need to do this, or we can't, and so you get stuck in this sort of analysis paralysis, it's a term everybody likes to use. And I was like, guys, we can't keep talking about this stuff. I said, we've got to build our plan for next fiscal year. And
Right.
so we did a session, but everybody needed to kind of say their piece, right? And so we did a session. We had whiteboard walls on 2/3 of this, or 50% of this, the conference room we were in. And so I said, all right, let's write down on one side, what are all the things that are important, right?
Right.
What are all the things that are important? Growth. You could say it was, we had a huge long list. I said, now what are all the things that we can control?
Mm.
That only we marketing can control, right? And then we looked at where they overlapped. And so then when something would come up and say, well, what about this? I said, we can't control that. So we're not gonna actually put that into our plan right
Do you
now.
have an example of like a thing that might seem like, this is good for marketing, but you can't control? Can you give me an example?
So access, right?
Mm.
So, knowing that, we might be having, yeah, I mean, I would say access is a great example of it. So, that we want to grow volumes for a certain area,
Right.
but we don't have line of sight to what their panel, what their availability is because they're not built into online scheduling yet. Right.
Right.
And so it's those things where it's not ready, or it's not ready yet. And so the organization has to continue doing some work before it's ready for us to do something about it. And so I would say that was a real key point of that. Another might be, all right, well, we want to promote something, but we need the communications team to focus on something. But the communications team is instead prioritizing other things. I'm like, okay, so we can't make them do that for us. And so we have to decide, it's something that we want to try and figure out that we're going to do on our own, or
Right.
are we going to just not prioritize it, instead focus on the high value work that we know that only we can do.
So that's one way of, that's one filter that we're using to prioritize is, what's within our control, what's not in
Mhm.
our control. And what are, even if there is, a bunch of things that are within the control, we can't do everything. Right. So,
Correct.
so how do you make those choices? And do you have an example of a time where like, hey, I really would have wanted to work on this thing, but we had to make a choice and we decided to either push this project into the future or decide not to do it at all? Like, do you have an example of a tough call you had to make that ideally would have been nice, but you had to prioritize somewhere?
Yeah. So I think a great example is you can do like a matrix, right? Like what's urgent and important, urgent, not
Right.
important.
The Eisenhower matrix.
That
Yeah.
whole thing, right? I guess that's, yeah. And so we would map stuff out on there. And then also what's an easy lift and what's a heavy lift.
Right. Like a quick
I
win
think
kind of
that's
thing. Yeah.
the other piece too. And so there were times where there were some things that we wanted to do that were very sort of marketing heavy lift or marketing innovation things, but the organization didn't necessarily understand the value of them yet. And so there were things that we wanted to do and sort of pined to do because it was like, these were the things that we love doing, like some of these marketing automation campaigns or propensity modeling, some things like that. But we had to prioritize what was important to the organization. And at the scenario that I'm sharing with was when we were going live with Epic and we knew that the website needed fixing. So those were the two things that we most prioritized, because we also knew that trying to drive volume in a time when our whole EMR system was being flipped was that we needed to wait for all that to sort of
Right.
settle out, before we could start to, do real aggressive CRM targeted campaigns. And so I think that's where we had to make some decisions internally. Unfortunately, what sometimes happens means that you're not investing in your own infrastructure or project management or things that you need to do that are important, non-urgent. And that I call it like the iceberg, right? There's everybody sees just the tip of the iceberg from a marketing perspective. They see the
Right.
advertising, they see the website, they see the social media, but they don't see all of everything that's underneath. And so we had to determine like when are we going to push one of these, sort of internal infrastructure, like not even housekeeping, but like stuff that we knew needed to happen forward,
Right.
even though it wasn't a priority to anybody else.
But that's going to pay off like in a year or two or something like that.
Like project management, like, do we wanna invest in a better project management system? Or an on like, a perfect example is having, like, a self-serve brand portal where people could go pull down branded templates or those
Right.
types of things so that we didn't have to design everything. Well, that's great and super easy once it's up and running, but it takes a lot of effort to get it built.
Right.
And so sometimes those are things you just have to decide, is that when I'm looking at website versus self-serve portal, website needed to take priority because of everything, all the reasons why. And the self-serve portal was a nice to have, and it would solve some of the more sort of day-to-day volume challenges that we'd have where people saying, I need a brochure or I need a this or I need a that. And if they could self-serve on their own, that would be great. So that's an example of something that I think you have to decide whether you're going to table it or not. And when your budget and your timing is limited.
Right. I mean, budget and timing is limited is, I think, just kind of like Tuesday
Right.
these days, right? And because you kind of gave great examples of how to prioritize and especially kind of focusing on the digital realm in general. What are things that when there are all these pressures around, right? What are things that are really important to not deprioritize, right? Or make sure that
Mm,
this is something you absolutely must continue to do from your experience, right? That
mm,
if that doesn't get done, even though it seems like something that's maybe not as important, it's
yeah.
really going to have huge collateral impacts. So, what would you say are those things that even in today's environment, right? What should people be focusing on, or making sure that they're not letting slip?
Yeah. I would say reputation, and I
Mm,
mean that in a multitude of different ways. I mean, certainly we've talked a lot about the website. It's clear you need to keep that healthy and you're going to continuously improve it because once you build a website, it's like the Golden Gate Bridge. You got to start all over again because it's going to be, right?
all
You
right.
just you have to keep it going, right? So that's important.
Yeah, I
But
mean
from
the
a
world around continues moving, right? The
right.
website can't just stay static for like 10
Yeah.
years, right?
No, no, and I think that sometimes that's a hard thing for people to understand that it's like, "Well, we just invested in it 2 years. How do I know I'm not gonna have to invest in it again in 2 more years?" I'm like, "Well, you're gonna, because that's the way technology
Right, exactly.
and digital works." But, so I think that, that aside, there are things that you need to make sure that you're focusing on. I mentioned reputation, social, right? So social media is I think you can't avoid it.
Mm,
And so you can decide which properties or, you want to be on or not on,
focus, right?
right? So you've got, Facebook and Instagram and TikTok and all those things. And you certainly want to own, properties for your, the branded properties for all of them so you can at least manage what's happening. But you can't stop the stem of people commenting on your social media, whether positive or negative. So I think service recovery, you can't take your foot off the gas on. I think it's really important that we're not only doing service recovery, but we're doing on our social outlets, but also doing, hugging our lovers, so to speak. Like, who are the people who, not just like saying, I'm so sorry you had a terrible experience, because if that's all that it is, you're just taking care of the naysayers, but we should be
Right.
rewarding and continuing to engage with the people who are saying positive things about us. And
Absolutely
that
right.
often can be deprioritized because of staffing issues. And I think there's
Right.
probably an opportunity for AI there again. I mean, careful, curated, human integrated AI. I think there's a lot there that you can't ignore that, right? And you can't ignore, during market research. That's an easy thing to cut, but you need to keep monitoring what your
That's a
brand
good one. Yeah,
awareness
you're
is.
right.
What's your brand awareness? Where are you relative to your competitors? What are people saying about your service
Right.
lines or your hospitals? Because you need that constant touch point to know how people are interacting with or reflecting on your brand so that you can spot problems sooner rather than later and address them.
Right. And so kind of in closing, I'm trying to figure out like we started off the conversation talking about how healthcare marketers are healthcare workers, right? They are
Mhm.
part of the front line. We got into how the digital experience and the website are part and parcel of the overall patient's experience and satisfaction and impression
Mhm.
of the system itself. We talked about how to prioritize in, very tight budget environments and volatile
Mhm.
situations. What do you think, like if I'm a healthcare marketer, let's say I'm a marketing director at I don't know, a community hospital or something, like what should I be doing, starting next week? Or what's one small thing that I can take a step towards that
Mhm.
would help me to better prepare or better navigate the waters that we're living in today based on all that?
Yeah, I mean, there's a lot, but I would say, and this has been a favorite of mine my entire career, like even back when I worked with performing arts organizations, is this concept and this quote of "You are not the target audience." So knowing that you're not the
Mm,
target audience. And so I would say, and that goes for you as a marketer, but that also goes for every individual that works within a health system, because
right.
marketing can be subjective. And so we all bring
It's part
our
art and science, right? There's a mix
it
of
is
both.
definitely art and science, but we all bring our own perceptions and our
Yeah.
own biases to what we think people need, what we think people want, and what's gonna resonate. And so I would say it's really critical, especially for a marketing leader, to know their target audiences. And I
Mm,
mean this in 2 different ways. One is certainly you need to know who you're trying to reach with your marketing, right?
right.
So, who are they? I mean, crystal clear, not just like moms, but moms of what age and what geography with what, are they moms of, teenagers? Are they moms of babies? Like, I think you need to get it as specific. You need to, I don't, I don't think, I know you need to get it as specific as possible, but don't forget the other audiences that are within your internal organization.
Okay.
Because when you're trying to build a business case or you're trying to understand and help people understand the value that marketing brings, you have to know what drives those people, what's driving your C-suite, what's driving your finance team, what's driving your IT team, what's driving your access and scheduling team. What are those drivers what are their pain points? And you need to talk with them in their language, not
Mm,
marketing speak, because you'll lose them. And I think this is a really critical and difficult thing for marketers to do, is marketing themselves internally within their organization.
right.
And this idea of wanting to over explain what we do. People don't need to know what a UTM code is and all those things, right? But
Right.
you need to be able to speak in their terms around the value that marketing brings to the organization. And then hopefully, especially if you're trying to build a business case for a new investment or a new initiative.
Well, that's interesting because it's so fascinating that we address so many subjects, but as we get to the end of the conversation, what you're saying is that be cognizant that one of the target markets of marketing internally is these other departments, is the executives, and you have to understand them as well as you're understanding your patients and their own experience.
Right.
Because that's basically, if you better understand your internal clients, you're going to be able to make that relationship that much more fluid, which allows decisions to be made faster, which allows you to provide the care faster down the line. So that's what I'm kind of
Yes.
understanding from what you're saying.
Yeah, so if you think about it like this, so if marketing serves as the voice of the customer, right?
Right.
You gotta think, and how do you represent the voice of the customer internally, knowing what their pressures and demands and priorities are, right? So if you can build those and when you can build those relationships and you can become a trusted partner, that's when you're going to be able to accelerate the value you're going to deliver to your customers. People know I mean, different marketers and different teams know kind of where they fit within that ecosystem, but it is that establishment of trust and being able to help people solve their problems. That's at the end of the day, it's what marketing is. And so you've got to do that internally as well as you got to do it externally. And so I think
Fantastic. Yeah. So
yeah.
putting ourselves in the shoes of our client,
Yeah.
right? That's basically what marketing does. We just kind of continue doing
Right.
it. And it all comes down, like I've had so many of these conversations, and it so often comes down to this governance and the internal interactions with all the different stakeholders. So thanks for kind of just highlighting that again, Amy. Thank you so much for the conversation. This was great, very insightful. I'm sure that there's way more to unpack out of your 17 years at Emory, but that was a lot of great insights today. Thank you.
It was great. I enjoyed the conversation. Thanks so much for having me.